Hi, I'm Chelsea Wiesman, and I'm interviewing for the consultant position with TFA. I'm completing my Master in Public Health from Boston University with a certificate in program management. My coursework has provided me with a solid foundation of program management skills, which, combined with my previous work experience in hospital emergency departments and a home for survivors of human trafficking, have prepared me well for the challenges of this position. I'm able to lead well, function on a team, and also work independently. I bring a sense of calm and focus to high-stress environments. International experiences in India, Tanzania, Rwanda, Uganda, and the UK have taught me to communicate well in multicultural contexts. I consistently display integrity, excellence, critical thinking, communication skills, and flexibility in my professional and personal endeavors. The briefing, which was emailed as part of this hiring process, contained details of the current situation at the Total Life Clinic, TLC, which is a TFA clinic focusing on the provision of antiretroviral therapy in Conakry. The data in the report depicts long wait times at the clinic. A few problems are apparent. First, the significant wait times seem largely related to processes that have to do with registration and handoff of information. Second, there's an initial delay caused by first handwriting patient data into a Blue Book registration system before then entering it into a computer system. This means that work is being duplicated unnecessarily, and a bottleneck in patient care is beginning early in the process. Finally, the fact that 86% of the day's patients are already at the clinic before 9:30 a.m. means that the majority of them will be waiting to be seen. In order to provide informed, usable solutions to the clinic, I would first request to be present on site. Once there, I would assemble a quality improvement team to investigate the issues further and formulate a succinct plan of action. The team should consist of key people in the service process, perhaps including the heads of pharmacy and medical services, as well as a member of PEPFAR, since PEPFAR is the primary funding source for TFA. Including a PEPFAR member would increase TFA's accountability and transparency in their relationship with PEPFAR and allow PEPFAR to provide insight and experience into the situation. In order to begin addressing the problems, I would need to understand the staffing structure at TLC. For example, is there a dedicated registrar, or are caregivers performing registration in addition to seeing patients? The first thing the team could do is develop an organogram to map out the clinic's personnel, reporting structure, and duties. This would allow us to see more clearly where there are problems and opportunities relating to staffing, which may be impacting service delivery. For example, if there are only a few nurses and some of them are handling registration, the hiring of a registrar may free up nurses to assist in reducing wait times, perhaps by triaging patients in addition to taking vitals, and handling visits for patients who present with less serious complaints. This would in turn free up the physicians to see more serious cases in less time. Next, a SWOT analysis of TLC would be crucial in determining what the clinic's current strengths, weaknesses, opportunities, and threats are, in order to see how the clinic is functioning and identify additional problems that may lend insight into why patients are waiting so long. I would also direct the team to design a simple survey to be administered to a focus group of patients, perhaps 3 groups of 5 patients each. This survey would be designed to determine what patients see as holdups to their service. Do they notice things that staff might not? The team would also be asked to gather more information. It would help to follow patients through the process to visually see where problems might be occurring. It's unclear from the data in the briefing whether there are significant wait times occurring when patients are leaving the clinic after their visits. The team should develop a more detailed process map depicting every step of the service delivery process and listing events that occur at each step. It would also help to know the technological situation at the clinic. Is there one computer or multiple? How many staff are trained to use them? Would it be possible to install a computer station so that patients can be entered into the digital data capture system after arriving, which would eliminate the blue books and handwritten data capturing process that slows down the initial intake of patients? In order to connect the dots between all of these factors, it would be imperative to know the financial situation at TLC to determine what resources are in play and what resources are needed. For example, are there funds to make larger improvements, such as technology upgrades, laptop purchases, etc.? Are there funding issues that constrict resources? Are there any personnel changes that could be made or additional personnel that are needed? This might look like developing a budget and justification or reviewing ones that the clinic is currently using. So to review, I would first go to Conakry, assemble a quality improvement team, and develop an organogram to look at personnel. a SWOT analysis to see the larger picture of the clinic, a survey to administer to a focus groups of patients, a more detailed process map, and a budget and justification to understand what resources are available in providing solutions. Finally, the quality improvement team would design and implement a PDSA cycle for the changes that were identified as necessary. Incorporated into this PDSA cycle would be the development of a patient satisfaction measure, such as a suggestion box or some kind of patient survey. The specifics of this would need to be adjusted to be appropriate for the specific patient population at TLC. The PDSA cycle will allow TLC to follow up with the issues and continue to improve their services as needed. In developing these deliverables, there would likely be a few key challenges. First, the issue of cultural differences and communication barriers. This would require a translator and a few culture briefings prior to going to Guinea. Second, it would be challenging to come in as an outsider and take charge of a team, so it would be important to spend at least one day in the clinic observing and building relationships with staff prior to assembling the team. Third, it would be difficult to take key staff from patient care responsibilities, so it might be necessary to require additional hours or reassign personnel strategically in order to free up necessary time for the team. Lastly, and in order to develop useful, sustainable solutions, TLC staff will have to buy in. This will be more likely if the staff are informed of what's going on and understand that their perspectives are crucial to solving these issues in an efficient and long-term way. Thank you for considering my application. I hope to see you soon in Guinea.